In the past 24 hours, grocery store employees, higher ed professionals, and some other groups waiting for the vaccine have spoken out against the new rollout plan.
But the governor is standing by his decision to vaccinate by age starting on Monday. Channel 3 Eyewitness News reporter Sharon Johnson is live at the Capitol tonight. And Sharon, some people with serious health conditions are saying they're really feeling left behind here.
Yes, and that's because people with chronic health conditions were next in line to receive the vaccine, and tonight they're asking the governor to reconsider this major change.
We feel that cancer patients in the state of Connecticut have been left behind.
Nicholas Robinson says his wife, Amanda Robinson, was diagnosed with breast cancer in October. Amanda is starting chemotherapy soon, and they were hoping she'd be vaccinated prior to treatment. Now the 38-year-old mom won't be able to receive the vaccine until, at the earliest, April 12th.
For someone who's starting chemotherapy and her immune system, while solid right now, won't be in the next 2 months.
That's due to the age-based vaccine eligibility timeline Governor Lamont released this week. People with chronic health conditions such as cancer were set to start receiving the vaccine next month. Governor Lamont says the list the CDC suggested, along with essential workers, was too broad.
They gave us a broad list of folks with comorbidities, those most likely to suffer health effects, and that represented about a third of the population.
Lamont says hospitals and health providers were worried about how they'd track the huge group, and he says they were concerned about massive delays.
The cleanest way to do it, 55 and above.
30-year-old Kristen Whitney Daniels has type 1 diabetes and rheumatologic conditions. She's now in the last wave of people to receive the vaccine, starting in May.
It's really hard to accurately say how devastating it is to know that I don't know when I'm actually going to be able to get it anymore.
Whitney Daniels is a chapter leader for the advocacy group Connecticut Insulin for All. She says many of her peers have been afraid to take jobs or have been stuck inside for months, fearing for their lives. She says they plan to reach out to legislators to rally against the change.
We've had the vaccine sort of dangled in front of us, those of us who have pre-existing conditions.
And the CDC recommends that people with pre-existing conditions receive the vaccine after people 65 and up receive it. New York and New Jersey are following those guidelines with some delays. Live at the Capitol tonight, Sharon Johnson, Channel 3 Eyewitness News.